Welcome back. In this segment, you are going to learn how to properly use a blood pressure monitor and what instructions you need to follow to get an accurate reading. Let's start with a couple of steps you need to follow prior to measuring your blood pressure. Make sure you don't smoke, exercise, drink caffeinated or alcoholic drinks for at least 30 minutes prior to measuring. These activities temporarily raise your blood pressure and you might not get an accurate reading. Next, make sure you empty your bladder. Next step is relaxation. The American Heart Association recommends relaxing quiet time or deep breathing exercises for at least 5 minutes prior to measuring your blood pressure. This might be a good time to practice meditation, but it could be as simple as deep breathing activity. There are two most popular at-home blood pressure monitors. One is a cuff for the bicep, and the other most common type is a wrist monitor. The American Heart Association recommends that we use the cuff monitor since it has been proven quite accurate. Now that you are ready to measure, let's make sure you know the correct positions. You could measure in a couple of different positions, sitting down or laying comfortably in your bed, but there are a few rules and instructions you need to follow. For sitting down position, you need to make sure that your back is straight and supported on a chair or a couch. Your feet should be flat on the floor and relaxed. It is very important that you do not cross your arms or legs. The arm you're measuring on should be supported on a flat surface like a table, and it should be at a heart level. You should always try to measure on your left arm first, unless that arm has an injury or discomfort. Why always on the left? Because it is closer to the heart. The other arm can be relaxed on your lap. For a laying down position, make sure you're relaxed and laying on your back. Same rule applies. Do not cross arms or legs. Remain relaxed with arms by your sides. Now let's see where and how to place the cuff. The bottom of the cuff should be placed directly above the bend of the elbow. Some monitors have an arrow on the cuff or a marked spot indicating the artery mark. This mark should be aligned with the artery that they usually use to draw blood on you. Check your monitor's instructions for an illustration or have a healthcare provider show you how. The fit should be snug but not too tight, leaving enough space to be able to slide 2 fingers in but not be able to fully rotate the cuff. Try to take your measurements on skin. If you're wearing a top, however, you want to make sure that it is a very thin material. Don't roll up layers of clothing because it creates a ring that can disrupt blood circulation and it will cause an inaccurate reading. Now let's see when and how often you should measure. Try to measure at the same time every day. You could measure in the morning and in the evening. It is best to take the readings daily. You should measure a couple of times per day, especially after a change in treatment and during the week before your next appointment. It is important to record your readings and keep track. Take multiple readings and record the results. Each time you measure, take 2 readings 1 minute apart and record the results. You could record the results on your phone, create a spreadsheet on your computer, or put them in a notebook or a piece of paper. If your monitor has a built-in memory to store your readings, take it to your doctor's appointment. Some monitors may also allow you to upload your readings to a secure website after you register your profile. What should you write down and how? Your record should have 4 columns. One is for the date, second one is for the time, the third one is for the blood pressure reading, and the fourth column should be for the pulse or heart rate. What is my normal? After about 2 weeks of daily measurements, you should have a pretty good idea of what your normal range is, and you will be able to look at your numbers against the recommendation. This will also allow you to evaluate and recognize if your pressure is higher than your normal readings. Why is it important to keep your readings? A single blood pressure measurement only tells you what your blood pressure is at the moment. A record of readings provides a better picture of your normal range. This is especially important if you get unusually high readings while you're at the physician's office. You might have heard of the white coat syndrome. This is a case in which we get very uneasy and stressed out when we go to the doctor's office, and this often results in high readings. At home, however, your pressure is considerably low. It is important for your physician to see a time lapse of your readings so they could do the appropriate treatment. Now let's see what we can do if we get a high reading. A single high reading is not an immediate cause for alarm. If you get reading that is slightly or moderately higher than normal, ask yourself the following questions. Did I forget to take my medication? Make sure you take your medications as directed. Did I drink enough water? When we are dehydrated, our blood pressure is higher than usual. Did I get too stressed out? As we have seen in other segments, stress negatively affects our blood pressure. Am I sick or in pain? When we have an infection or pain in our body, or if we're fighting a cold, flu, or a virus, our blood pressure is also slightly higher than normal. If your blood pressure reading suddenly exceeds 180 over 120, wait 5 minutes and test again. If your readings are still unusually high, contact your doctor immediately. You could be experiencing a hypertensive crisis. In that case, it is very important that you have someone to help drive you. It is not a good idea to drive or be alone when your blood pressure is unusually high. A friend or a family member could help watch over you. If your blood pressure is higher than 180 over 120 and you are experiencing signs of possible organ damage, such as chest pain, shortness of breath, back pain, numbness or weakness, change in vision, difficulty speaking, do not wait to see if your pressure comes down. Call 911 immediately. Now let's talk about medication. Medication can affect patients with the same condition in very different ways. That is why it is important to follow your physician's instructions. Soon after you start making the lifestyle changes, you may feel better. You might see lower numbers and you might think to yourself, I don't need the medication anymore. Do not stop taking the medication until you discuss it with your doctor. It is important to let them know that you have been exercising, eating healthier, and making lifestyle changes, but make sure you follow their guidance and take your medication as directed. Remember to keep track of your numbers and stay motivated and disciplined. Change might be challenging and won't happen overnight. If you need support and guidance, make sure to contact your nutritionist or wellness coach. Mahalo and aloha.